Few things that were missing I would like to add over here. Few abbreviations such as we can see normally in the case notes 2 by 52. Like 52 is the number of weeks per year. So it is the way it's written. We can write down, let's say, after 2 weeks. Or if it's written RV 2 by 52, mean review after 2 weeks. So we can write down his review appointment has been scheduled after 2 weeks, right? Similarly, we can write it down, let's say 2 by 12. So it stands for 2 months. 2 by 24 stand for 2 hours, right? 3 by 7 stand for 3 days, the way it's written. 6 by H stand for 6 hourly, right? Dash stand for without. Question mark with something, let's say, uh, AMI is mean that possibility of something. We can write it down. So these are some standard abbreviation we have to use. And we can also see that history can be written as history. FTA, if they have written, it should be failed to attend in small form, right? DOB should be date of birth, BD 2 times a day, and so on. So part, the last slide area. Here we'll be discussing about uh, the importance of the language. As you can see, this is a clinical communication. So you just need a medium of language to translate or transfer your message, your information. So normally the technical language we would be using. However, in terms of linguistic, we can use different tenses. For the sake of example, mostly or commonly used tense will be uh, like the past simple, past indefinite. That is one of the most commonly used tense in OET writing. So if you can see there, like we can write this all letter. You can say in the past simple tense. Let's say starting from introduction, we can use the past simple tense in the introduction. Uh, Depends upon the introduction, but you can use either past simple or else present simple in the introduction part, right? So or maybe present simple. So the tenses of intro will be either past simple, present simple, and can be present perfect continuous that you can use in the introduction, right? Okay, so let's start with the introduction. The things that we are using in the introduction. First of all, in the introduction, a better approach to convey your message, you can say whatever the reason of writing is, we can use for some of the following thing in the introduction. First one is the relative clause. So what is the relative clause? It is quite important thing. Like you will show the demonstrability of complex sentence, it is important for you to get the B grade. Let's say we do write, let's say I'm writing to refer Mr. X, who's who presented or whose features are suggestive of. Now, this is the first rule. You have to understand the use of relative clause is important in the introduction. Now, second thing in the introduction is the appositive. What is appositive? Appositive is a quality of noun or noun phrase placed after another noun that will describe the quality of the noun. For example, I'm writing to refer Mr. Khalid, comma, a 48-year, normally we write it down, old man. So this is a positive noun, or I am Khalid, an accountant. This is a positive noun. We can use them in a sentence. The general rule for grammar is when we will be using a positive, either in this format, let's say thank you for seeing Mr. Khalid, we need to put comma over here. Let's say an accountant, if it's important to write it down. If it's important to write accountant, thank you for seeing Mr. Khalid, an accountant. Let's say who features are suggestive of let's say diabetes mellitus. Full stop. In this case, there is no comma after accountant. But if we are continuing the sentence, let's say for further management, right? So we will put comma after accountant as well over here. So this is a general rule of grammar that you have to follow in the introduction. The concept wise, it's defining and non-defining clause. When we have a defining clause in a sentence, we'll not put comma. But when we have a non-defining clause, we use comma over here. Okay. So this is some basic rule of the introduction that you must have in your introduction. Beside the clinically relevant things such as most important complaint has to be written. Still, you must have these things in the introduction part. Anyhow, so the tense that we use, as we discussed previously, is the present simple or past simple. So first of all, the rule of present simple that we use first form, and with he, she, we can use s or es with the first form of the verb. Okay, let's say he reports, right? Like that, or he does. We use a es with that. He does not smoke. He reports that he has been having, let's say, whatever. In past simple, we can just use the second form. For example, he presented, he reported, right? These are the few, you can say, basic grammar rules that we already know, but just to quickly revise it. And we can see that mostly in the letter, we will be using past simple, such as I discussed with you, like after introduction or even introduction, I can write it down. I'm writing to refer Mr. XYZ, who presented to my clinic with abdominal pain for the last 3 days. I would appreciate if you could provide your definitive diagnosis. So you can see we have written the simple form. Then we can see now we have the uh, what we can say in the body part. Let's say we can write it down initially. Sorry, initially, Mr. Mark, Mr. Y, so let's say, presented with, let's say, with 5 days history of mild cough. Let's say. So let's say you can see that I'm using past simple only. Okay. Then we can add on in addition. He was also, yeah, he also, let's say. So we can see that I'm also using maybe past continuous tense over here or past simple tense along with that to show the range of grammar mostly. Okay. We can also use the present perfect tense. This is also, you must have to develop mastery in the present perfect tense. It's quite important. You can see in OET writing, most of the letters they are covering, like an event which starts from some time and remain continue or finish in present. Let's say there is an event that started in the past, let's say, and it's continue till present. We can use the past present tense in perfect form. Let's say we can say that Mr. XYZ in today's visit condition has improved. So whatever the condition was, let's say even if it's a pain or anything, it's improved. Okay. We can also write it down. I have worked in this hospital, let's say, for 3 years. Again, present perfect tense, right? Or he has attended physiotherapy session for 3 months. Normally, present perfect tense, normally we write in the today's visit, the active issue, right? The progressive form of the present perfect or present perfect continuous tense we have to use for an event that started from the past and still continue. Let's say Mr. XYZ has been suffering from diabetes mellitus type 2, let's say, since 2008, let's say. So we can see that it's a past event started in past 2008 and it will continue. We can also rewrite this sentence in this way. Mr. XYZ has had diabetes since 2008. This is as same as you have written the sentence. Mr. XYZ has been suffering from diabetes, or Mr. XYZ has had diabetes since 2008. So it's as same as you have written the sentence. So we need to understand like when to use present perfect tense and when to use past perfect tense. Okay, common source of confusion in these tenses are when to use for, when to use since, and when to use our. So one by one, let's discuss it. We can use for a period of time when the start of time is not being mentioned. Let's say, if you can see, I have been studying for 3 hours. We don't know which yours, right? He has been suffering from diabetes for 1 year. Let's say, right? He has been having abdominal pain for 2 hours. So these are some examples that you have to understand. Even for this one, Mr. XYZ has been waiting in OPD for 10 minutes, right? So now we can discuss about the use of since. Since we use when we refer to start of time. When we know the start of time, let's say he has been suffering from diabetes since 2001. Let's say you can also write it down. Uh, He he has been taking his diabetes medicine since 2008. Let's say. Okay, and you can also see that he has not been smoking since 2019. And Mr. Mark has been waiting in lobby since, let's say, 9 a.m. Right? Like that. So when we know, and one important thing that you should not be confused of, let's say he has been having abdominal pain since morning, since last week, since last month, right? And so on can be used with since when we know the start of time, right? And our, we have to use our when we have to write it down. Sorry, when we have to write it down in present perfect tense for we can say for an event that describe the repeated event, let's say, Okay, or change in condition. So let's say repeated event mean if we have three visits with mild chest pain, so it's a repeated visit. We can use our. I'll explain you how. And change in condition, either it could be worsening or it could be improvement. So we can write it down. Let's say about the past 3 months or the past, let's say, 2 months. Put comma. Mr. Mark condition has deteriorated. When we use this time clause first, we'll put comma. But if we write in flip order, let's say Mr. Mark condition has deteriorated over the past 3 months or 2 months, there is no comma. Okay. Then we can write it down. Mr. Mark had presented thrice with mild chest pain, let's say, over the last 6 months or 2 weeks, right? Or Mr. Mark abdominal pain has worsened over the last 3 days. Okay, so these are some of the examples for since, for, or ever. Okay, so is it clear to you? Common mistakes that we do. He is suffering from diabetes since 2007. This is grammatically wrong because we cannot use is with since. And normally candidate write down he was diagnosed rather than is, since. It's still wrong. So with word diagnosis, we can use either in, he was diagnosed with diabetes in 2007, or either we can change the sentence. Let's say he has been suffering or he has had diabetes mellitus since 2007. Right? Repeat it. Okay. Candidate
ये
also write it
दोबारा
down.
बता दें मुझे
देखें अक्सर we can write it down. The common mistake, we write he is diabetic, let's say, since 2007. अक्सर लोग लिखते हैं he was diabetic since 2007. In both of the cases, these are the wrong sentences. We can write down he has had, let's say, diabetes mellitus since 2007. And if you want to write in different way, you can write down he was diagnosed as a case of diabetes mellitus in 2007. So these are two examples for your better understanding, right? So that you can understand. Common mistake candidate makes, I'll write it down for you as per the correction. We write it down, let's say Mr. Allison has problem with arthritis in her hands. So it's a wrong sentence. We can use the present perfect tense over here. Mr. Ellison has been having problem with arthritis in his hand since 2007. Anyhow, so these are a few examples for the tenses. Now we can see there are some other things that we have to discuss with you. The past perfect tense, like when to use the past perfect tense. Past perfect tense mostly we use in the body of the letter because it can be written when we are making a comparison. It can be written when we are making a comparison. For the sake of example, if we can see that, like when we have to compare two events in the past, let's say, when we have to compare two events in the past, then we can write it down together, past simple and present simple. I'll give you an example for that. So normally, like we write in the what we can say in the present, sorry, past simple tense or present perfect tense, but past perfect normally it's being written in the letter when we have to differentiate the order of events. I mean by that, near past and far past. So for near past we use simple, and for far past we use perfect tense. Just okay, we can see there she reported that she had stopped OCP 6 months back. So it's a difference in event reported and stopped. We can also see that despite stopping OCP, which she had been taking for 4 months, 6 months, whatever, she was not able to conceive. So had been and was in combination can be written so that we can differentiate the sequence of events. Right? We can discuss about the article as well. Now in articles we have countable nouns. First of all, are and the. So let's start with the you can say uh, are and we have to use the definite and indefinite article. So let's say indefinite articles are and we have to use with singular noun if it's countable. So we can use with the singular noun. We should not use with the plural. No article with plural. So let's say there are few things that are countable, such as complaint. It's a word noun countable. Let's say ache. Before we have to use adjective is that it's countable. Accountant countable. Appointment. Let's say a follow-up appointment schedule. An appointment with doctor was scheduled. Okay. So these are some of the word that you can see: condition, countable, examination, word, countable, right? So you have to use are before that. But if we are going to use, let's say, like increase, let's say, is countable. Investigations, countable. Okay. Smoker, countable. And with vowel sound, like that as MRI, X-ray, or we used to use an with that, right? With vowel sound, we have to use and with that. There is no article with uncountable noun, such as accommodation is uncountable, cancer word is uncountable, pain word itself is uncountable, tissue is uncountable, treatment is uncountable noun. Okay, and we have to use the definite articles. We have to use the definite article when we have to refer something specific, right? For example, like we use he presented again with the same complaint. The okay, Mr. X has been working in the hospital, name of the hospital, for the last 5 years. Okay, we can also use the body part. He presented with pain in the left ankle, or in his left ankle as well. We can write down. We can also write down the patient. Let's say. So we have to use with something specific article the name of the diseases. Let's say, do not use article with name of disease, such as cancer, such as Parkinson, Alzheimer, Bell palsy. No need to use any article before that. Words same we used to use or similar article with that he presented with the similar complaint, right? With the same complaint. Okay. We should not use any article. Gerunds, the ing form. I would we can say the fourth form of the verb. Let's say he has been advised to reduce smoking for 10 years, not the smoking for that, right? Then there are some rules of capitalization. So whatever it's a proper noun, we have to use the article with that. Let's say if we can see that we have, let's say, the name of disease such as Parkinson. Just okay. Sorry for inconvenience. So we have proper noun, like say Parkinson. P should be capital. Alzheimer. Let's say A should be capital, right? So we have to see that how can we use these things. But with other known like common noun like diabetes, blood pressure. So disease that is named against some of the scientists, okay, or the person that can be labeled as with the capital letter. But the other diseases such as diabetes, blood pressure, should be written in the lowercase. So medical procedures. Now medical procedures, you have to write it down in the lowercase. Medical procedure should also be written in the lowercase, right? And uh, such as uh, or even in the investigation or let's say C-section, you can write in full form. It should be in the lowercase. C is not capital, sorry, right? Body parts in the lowercase. Let's say heart. Let's say knee in the lowercase. And job titles. Let's say the cardiologist. It should be in the uppercase. The director of nursing. Let's say uppercase. Name of the institutes or the hospital. It should be written in the uppercase. Let's say the Shifa Hospital. Okay. Name of the hospital address should be written in the uppercase. Okay. So the specific days such as Christmas, uppercase, month, uppercase, day, let's say Wednesday, Monday, uppercase, right? The word I should always be capital no matter what. And the first word of the salutation should be capital, such as dear, doctor, James, let's say, J is capital. And yours, sincerely, Y is capital, right? And or yours faithfully in cases, Y is capital. So these are few example of articles. I hope that is your active voice and passive voice. Basically, in any of the writing tasks, it is important for you to show the density in the sentence structure for both active and passive voice. You have to use active voice when you want to create a personal tone or impart a subjective information. However, when we have, you can say, to use passive voice, it will focus attention on the most important element of the sentence, as patient, procedure, and treatment rather than patient. Let's say if this is active voice, I have, yeah, I advise him to modify his lifestyle. Now this is indicating of like I am focusing like on myself. My part is more important. If I can add in the passive voice, the patient was advised to stop smoking. Now it's focus on the patient. Similarly, we can write it down. I advise her to do exercise in order to prevent further complications such as blah blah. And he blah blah exercises were advised to prevent further complication. So active voice and passive voice, but mostly when we have to use passive voice, we do use passive voice when we are focusing on the treatment or the patient himself. Let's say transformation of the passive voice. He takes metformin daily. So in passive voice is metformin is taken daily by him. That is in the simple form. If we talk about the, we can say continuous tense, present continuous tense, you can write it down. He is taking metformin. I forget to mention one thing before I can proceed. The name of the medicine, if it's the brand name, it will be in the uppercase. If it's the short name, it will be in the lowercase. Anyhow, he is taking metformin daily. So we can add it down. Metformin is being taken daily by him. Same is the case with the past simple. The patient took aspirin. Let's say aspirin was taken daily. The patient took 3 tablets daily. The 3 tablets were taken daily. Or the patient was taking metformin. So metformin was being taken by the patient. And present perfect tense, he has taken metformin daily for a period of 1 year. So metformin has been taken for a period of 1 year by him. Right? The patient has been taking aspirin. There is no passive voice for that. It's really used in the passive voice form. Right? So active to passive transformation is important part of the writing task. Now we have other thing that we can say the clauses. We have contrast clause, right? We have purpose clause, we have reason clause, and we have time clause. So we'll discuss them. So whenever we have to have contrast, we can use although, even though, despite, in spite, while, and so on. So where we can see that first of all, these are the complex sentences. Before we can discuss complex sentences, in complex sentences, we have to understand there will be one independent clause and one will be dependent clause. So when we combine these two clauses, it will become the complex sentence. And compound sentence, we have to combine two independent clauses with the help of conjunction. Anyhow, so here we have to see, let's say, although he, let's say, he has modified his lifestyle, comma, he is still overweight. You can also write down despite an improvement in her condition, she is still weak, and so on. Similarly, we have clause of purpose where we can use in the clause of purpose we can use want to express certain action that why it was taken in past and why it was necessary in the future. It is necessary in the future. So we can just write it down. Let's say in order to reduce his weight, he was advised to modify his diet. Okay, or in order to reduce his weight, he has been advised, what better, to modify his diet, and so on. Then we have clause of reason. Now, the clause of reason, it's emphasized on why this action has been taken. Let's say, due to his high blood pressure, he was given this medicine. Let's say, or due to, let's say, due to excessive workload, he has high blood pressure these days. Let's say this is something for clause of reason, or because he has a positive family history of diabetes, he has been advised to modify his lifestyle in order to prevent the diabetes mellitus. Lastly, we have time clauses which include initially, at the time of admission, and so on. These are the time clauses, right? So now we have to see the few more examples that would be helpful for you in your OET writing. Use of prepositions, where you have to understand like when to use preposition. Let's say for anything happen in some month, we use in, like say November and December. On is used for day and dates, such as on Monday, on 20th. At is used for time of day, at 6 o'clock at night, at lunchtime. And some word required no preposition, such as yesterday, today, and so on, right? For countries, we can use in. For surface area of this something, we can use on. At is used for place of activity, such as home, at work, at the wound site, and so on. Few example of preposition we have discussed with you. So I hope it's somehow clear to you. Okay, there are some useful signal words that you have to use in your writing, which includes as well as, right? We can use as a result. We can use along with some signal words. Apart from this, at that time, beside that, because of this, based on, consequently, during, duration, despite, for this reason, hence, however, in order to, it should be noted, please note, and so on, some of the areas. And you should also remember that there should be subject verb agreement. If you have a singular subject, we use this singular. Let's say the patient, uh, let's say, sutures has been removed. It's with the singular word we can use the has been. But if you have plural, the patient sutures have been removed rather than has been. Right? Yeah. Commonly asked question like when to use the Mr. and Mrs. So we use Mr. for adult man or married or single man as well. Mrs. is used for married woman including widows. Miss MS is used for both married or unmarried women. Okay, and Miss is used for young girl or unmarried woman. So I think it's clear to you, Mr. for adult man or married, Mrs. for woman married and unmarried, Miss for married or unmarried women. Those who don't want to say their title or status, and Miss is used for young girl or unmarried woman, right? Is it clear? Okay. One most commonly asked question that when and how often we should use the person name in the letter. So remember that once you have to write patient full name below the opening salutation, then use the patient name once per paragraph, and after that you can use pronoun. Okay, just write the patient name as per. You can call the patient name, with first name or second name, but do not get confused. Just use one name, right? There is no need to write the patient name out in full form in the introduction if you have written in the salutation. Let's say in the regarding part, when you write down Mr. John Ellison, so you can write it down. I'm writing to refer Mr. Ellison or this patient as well. No need to write it again, right? With some word advice, let's say we used to speak. Let's say advice was given to reduce her weight. It's grammatically wrong. We are not supposed to use her. We can simply write it down. Advice was given to reduce weight. Yeah, I advise him to reduce weight. Yeah, you need to reduce weight rather than her. Okay, advice was given reduce weight rather than using her. Okay. Secondly, we cannot use. So it's a known wrong thing. We can just write down. She had lost weight rather than writing again her with that. Okay. Sometimes it's difficult for us to understand the difference between noun and verb as a commonly confusion complain versus complaint, right? Complaint is a noun and complaint is an n. So n is a verb. Accordingly, we have to use complaint is a countable noun. So we can use we can say before that. Let's say if we have a verb already in the sentence, we are not supposed to use complain and with n. Similarly, we'll go for advice and advice, let's say, versus advice. It's a noun, it's a verb. Same rule for that. And we have to use suggest and recommend versus advice. Okay. We have different rules for that. When we are using suggest, we have to write it down that with that. I suggest that you should come next week. And I advise him to come next week. Right? Similarly, I recommend that you should come next week. So the word suggest and recommend cannot be followed by an object pronoun such as him or her. This is a common rule that you have to understand. Suggest and recommend cannot be followed with the object pronoun such as him or her. I suggest that or I recommend that rather than using I advise her or similarly explain versus tell. So after you use explains, we have to use do with that. I explain to them about surgery and I told them about surgery. Right. Okay. So again, these are some rules that you have to understand. Request word as verb and as noun. Let's say the patient requested painkiller or he made a request for local anesthesia. So try to understand the difference. Similarly, affect with A versus effect with E. So affect with A is verb. Let's say the patient has not been affected by the treatment. He has not been affected, small, by the treatment. And effect with E as a noun, the patient had has had no effect. Pronunciation of the both is the same. Affect with E we can write as a verb. The patient had not been affected by the treatment, or the treatment has had no effect, like that, right? Similarly, the word widow or widower. Widow is a noun refers to woman. Widow is for woman, and widower is a noun refer for man. And widowed refers to both men and women whose spouse has died and has not remarried again, right? We can use widowed with that. Okay. Similarly, small things, but let's say allergy versus allergic. Now, allergy is a countable noun. Let's say Michael has no known allergy. Yeah, Michael has a peanut allergy. And allergic is adjective. He is allergic to peanut, right? Like that. Confident versus confidence. Now, confident is adjective. Mr. Mark is not confident, let's say, in is not confident for surgery. Now, confidence is noun. The patient lacks confidence in surgery for his surgery, right? So with noun, we always have to use the verb before that, right? And let's say the common differences for during and while. Let's say we can use during hospitalization. The patient made a full recovery. During is always followed by a noun during hospitalization, right? The patient had many visitors during his stay in the hospital, right? And while is followed by a phrase or gerund. While in hospital, comma, the patient made a full recovery. right? While in hospital, the patient made a full recovery, or the patient had many visitors while recovering in hospital. These are a few rules that you have to understand. Okay, so these are some of the things from the grammar part. We have some expression. Uh, Casual form asks for to be replaced with request. Okay. Say to be replaced with state. Said to be replaced with stated. Like to replace with include, or such as, right? Get to replace with become or became. Okay. Think to be received, about to be replaced with regarding, a bit with replaced with slightly, thanks to be replaced with thank you, kids with children, and sad with, you can sad with depressed, till with until, lots with a lot. So few things that you have to use as an example for you. Okay, so remember that as this is a language exam, so we have to, you can say, work on. So it is important for you to understand that which things to be used and which things to not to use. In the case notes, they do use many abbreviation, medical acronyms, and technical language. So it is the responsibility of the writer that these should be transformed into full form. First of all, OET is an English language test, and you need to demonstrate your ability to transfer your technical language into case notes into standard English. For some letters, you have to write someone who is not a healthcare professional, such as social worker or family member. Okay, and a referral letter is not a report; it's a standard convention of letter. Writing require a formal style of writing using the complete words. Let's say the we can see in the case notes they can write down abdo. You have to write in full form like abdomen. Okay, AC we can write down before meals. ADL, let's say activity of daily living. NAD, let's say no abdominal detected. Nocte in the evening, let's say. Mane in the morning, let's say. PRN as required, let's say. QID 4 times a day. R stand for right. You have to use the full form, right? However, there are some standard abbreviations such as milligram, gram, right? The we can write in the short form. It's totally fine. And these are the standard. Okay. So I hope this is something helpful.